Okay, today's date is January 31st, 2013. We're here with Kate. Kate came to me with a myriad of problems, and I'm going to let her give you a short summary of what she has been through or what her symptoms were when she arrived several weeks ago. Please.
The main thing I was experiencing was extreme stress at every situation. Too many people, too much noise, food allergies, everything was overwhelming, and I had to reduce my daily functions and basically stay in the house. I had severe food allergies. I had actually cerebral allergies where the allergies affect my nervous system. I am diabetic. I have diabetes too, and I have increasing food allergies to where I have a reduction of foods that I can eat, and it has basically overtaken my life. And that's fundamentally the main ones.
Right, and I believe, I was almost shocked when you came in. You could eat very few foods and you could take very few nutritional supplements. You reacted to just about everything, correct?
Yes, in fact, I cannot tolerate oral supplements in any form, whether they're probiotics, um, amino acids, vitamins, herbs, tinctures, absolutely nothing.
And how was your energy level?
It was very poor.
Okay. When you came to me, I evaluated you and I took a history, probably unlike anything you've ever had before, correct?
Yes.
Okay. And do you remember what things I really focused on?
Yes, the first thing you focused on were my condition and health of my teeth. And the second thing that you focused on was several scars that I have left over from surgeries 40 years ago.
Right. And you just gave me a summary today of what happened to you the first time. So I want the viewer to know that what I did last time was I injected the gum around a tooth that has a root canal that I thought was positive, meaning a disturbance to you. And I also injected a scar that was underneath your right breast, and I injected a scar that was on your central abdomen for many years ago. And you want to tell the viewer what happened after I did each one of these?
Well, the interesting thing is that after we did, Dr. Rowan did my gum first in the back of the tooth, and then he did a scar under my right breast. By the time he had done the scar under my right breast, I began to feel very relaxed. Then Dr. Rowan did my scar on my stomach, which was extensive. By the time he asked me while he was giving me these injections if I was how I felt, and I went to tell him that I was much more relaxed, and my words came out all garbled because I was so relaxed, and I just felt so much relief from having these procaine shots on my scars.
And has that relief persisted till today?
Well, I think that, I really never noticed prior to having these procaine shots that it even bothered me at all. And so it wasn't until I had the procaine shots that I became a lot more relaxed.
Okay. And you had mentioned before the relaxation is important because you reported cerebral allergies and brain fog. And
Yes.
would you say that this has lifted some?
I wouldn't say that it has changed. What I would say is that I have had IV drips. I've had my blood ozonated, and I've had here,
Yes.
and I've had a
Essential phospholipids.
essential phospholipids, which is a 15-minute drip,
Yeah.
followed by a 15-minute drip for glutathione.
What did they do for you?
They were remarkable. I mean, after the having the blood ozonated, within about 30 or 40 seconds, I felt relieved. And then I went into the phospholipids drip, and I felt relieved even more. And then during the glutathione drip, I felt relieved again for the third time. I left the office and I went home and I felt that I had lost 20 years of anxiety and stress. And I mean, it was absolutely remarkable. I had so much energy and so many natural boundaries back, whereas before, everything that I was around went through my body and my nervous system. And I had so many boundaries, I thought, my God, I could give a presentation with
Thank you.
feeling so good. And that has, my well-being has continued. The intense feelings of these boundaries has settled down. And I have just basically walked through a door, a flip side of the coin, where I am so much better and have so much less stress and am so much more grounded in my body. And I would say just a teeny bit more, I think.
Okay, Kate, we just got interrupted, and you were telling me earlier that on a scale of 10, you felt 8 to 9 points better overall. Is that correct?
Absolutely.
And what additional would you like to tell our viewer?
I would just say that, you know, you're not just your body. It's a complex process, and I am emotionally and physically, my well-being all around has improved so greatly, and I'm so relieved to have found somebody who is willing and interested, actually, genuinely and humanly interested in helping me get better.
Thank you. And I want to toot my own horn on one thing. I went right for your teeth, right?
Yes, you did.
And I said, I think you have a problem, correct?
Yes.
And I sent you to a dentist, and what did the dentist confirm by x-ray?
That I have
Infections.
Infections in 4 teeth.
Right. And I did that with kinesiology.
Yes.
Okay. So you're going to get them taken care of as a first order of business, correct?
Yes, I am.
Okay, thank you. May I post this on YouTube?
Yes, you can.
Thank you.